Go.
Well, I just had another video for our Summe Medical Clinic, and I know one of the big things that when I see patients on a daily basis, we talk about disease a lot, such as high blood pressure, diabetes, back pain, and like with everything, it's a domino effect, so that you'll have a disease. What caused that disease is usually has something to do with weight, so such as diabetes, high blood pressure, low back pain, and the troubling thing is how do we actually treat that weight component. And as you guys all know, I only have about 15 minutes in a treatment room to do my chart note, to do a prescription, and then go on to see the next patient. And it's really nice to be able to have a referral place where I can send patients to work on a better way of working at nutrition. And something that I learned recently, there is a difference between a dietitian and a nutritionist. And we're lucky today to have Ramey Nutrition here that actually has a clinic in Seattle and up, in Linwood?
Shoreline.
In Shoreline. Mm-hmm. And we have Sarah and Scarlett.
Yeah.
And now, Sarah, you run the clinic down in Seattle?
Actually in the Shoreline.
Shoreline, okay.
Mm-hmm. Yes.
And you do more therapeutic?
Yes, we do therapeutic nutrition on medical nutrition therapy. So that can range from diabetes, weight management, pre- and postnatal care, food allergies, Crohn's disease, anything that has to do more on the medicine side.
So a typical person that comes in with diabetes and blood pressure
would come see myself.
See that? Okay.
Yeah.
And then Scarlett, you're in the other clinic,
Yes.
which is?
We're an eating disorder facility, so we do all of the anorexia, bulimia, OCD, anxiety, depression, food-related issues that have to do with mental illness.
And where's your clinic located?
In Seattle, in the U District.
Okay. So now, for billing purposes, is there a difference between a nutritionist and dietitian for the insurance?
Dr. Summe, we're really glad to be here, and yes, there is. It's interesting because nutrition is such a hot word. It's such a buzzword, and we think of the people that do nutrition as nutritionists. However, dietitians are a separate sect of that. So it would be akin to saying a personal trainer is the same as a physical therapist. So a physical therapist has to have a doctorate in physical therapy, whereas a personal trainer can take a weekend course. Now, nutrition, they actually need a bachelor's degree in nutrition in order to practice nutrition and get a license in nutrition, which you pay for and get a license. Registered dietitians have to have a bachelor's and or master's degree in nutrition. And then we have to do a 2-year physical and clinical internship based on hospital medicine. So we can actually walk into a hospital and start doing treatment, whereas a nutritionist would be banned from doing that. So a nutritionist can help a beauty pageant person develop their diet to look their best when they're going to come out in a bikini or something like that. A dietitian can order a tube feed for a patient in a hospital.
And take more of a medical approach.
Correct, correct.
Something that was interesting, we were just talking off camera here recently, and we were saying that in your particular clinic, it's not just here's a list of diet foods that you can do and do's and don'ts. It's more you're kind of blending that in with almost psychology or counseling. Is that the difference between a dietitian that I would see someplace else and maybe seeing a dietitian at your place?
Dr. Summe, we're different in that we are dietitians. However, education is rampant right now. You can find out anything that I know through the internet. You can Google everything that I have learned in my master's degree. So education right now is not our specialty, it's motivation. So we take your goal of weight loss, or this person has hypertension, I need their cholesterol to come down, and we discuss how to get there.
Okay.
Because they know how to get there. You've even told them how to get there. Lose weight, drink more water, more fruits and vegetables. We don't need to say those things again. We need to say, we know you know this. What's going on?
Okay. So that would, and then the insurance also recognizes the difference too. So like you said, that if I went and saw a nutritionist, my insurance wouldn't recognize that most likely, but if I saw a dietitian, they would, because they would see that that is actually an aid to my high blood pressure, an aid to my diabetes. Just like if the doctor wrote out a prescription for a blood pressure pill, they could write out a prescription to go see a nutritionist or see a dietitian. Like that, when you're getting those two mixed up. So a dietitian, knowing that that is an insurance billable situation. Okay.
Yeah. And you can write a prescription for a nutritionist. That is usually covered the same as acupuncture or alternative medicine routes, and lots of people write prescriptions for nutrition because that's taking a healthier person and moving them into figuring out micronutrients to fine-tune their health. Your patients need drastic changes. So they need that medical nutrition therapy, and what we do is that therapeutic nutrition. So when you're making giant life decisions like massive amounts of weight loss, or diabetes is now in your spect and you're not running a 5K or something like that, you need a dietitian to say, this is a big deal. And we need to talk about emotionally what's going on, therapeutically, how is your family handling this? What are you running into?
Yep.
What else?
Well, there's a lot of reasons why people come in and have those barriers. And so it can stem all the way from childhood all the way up to present days of stress. You can name it. And so we spend the time of really figuring those issues out and helping them come to grasp of how to handle that. And then they can kind of, everything else falls into place. So usually the weight, the exercise, those types of things fall into place. Another thing that Ramey Nutrition offers is fitness in our environment. So we have a fitness instructor, because often people, when you say, oh, go exercise, they're terrified of going to a gym. I haven't exercised for 5 years. How am I supposed to go to a gym? So we have a trainer right there. And we will work with them one-on-one, figuring out, okay, if they have bad knees, what other exercises can we do? And especially with diabetes, we have a very specific fitness instruction for diabetes as well.
And these are people who have moved very little in their life, and that's not going to be the gym. That's very intimidating. We work with a no mirror area. We work with very, very gentle movements, and we teach people how to move their body again, gently. So that it's not okay, we're going to go on a brisk walk. Well, they don't walk briskly anyway. And there's a reason they don't. It's not that they, are unmotivated. It's that their knees have not worked this way in a long time. So instead of going on a brisk walk, which is a great idea, it just is, that's right out of the book. But that's not the patient.
It's a real world.
Yeah.
One of the things, too, you're mentioning that, of course, patients, and I do this all the time, too, is you'll get on the internet and you'll read about something, and then you wonder, okay, is that, myth or fact? And so even though you might be able to get a lot of this information maybe on the internet, it may not be correct information. So it may be, we were just talking off camera about, artificial, not softeners, but artificial sugar things, such as, NutraSweet and all the things that were in Coke and Diet Coke. And you were mentioning about the rat study, and can you bring that up again? What was going on there?
Well, the rat study, which is the one that we're all familiar with on the internet, is an interesting one because it goes through how evil, and it started the whole movement for the evilness of artificial sweeteners. Which if you talk to anyone and you say, is Diet Coke good or bad? It's bad. It's bad, it's bad, it's bad. Back when Coke switched to Diet Coke, was Diet Coke healthy or not? Oh, Diet Coke is very healthy. So we've switched that, and this study made such an impact because it went viral. Now, as consumers of the internet, we need to be very careful, because if you read through the study, number one, we need to know who funded the study. The person that the company that funded that study on artificial sweeteners was C&H Sugar. So they have a very vested interest in getting statistics. How much sweet and low are they going to give a rat